Around 3,000 people here die of sepsis every year, and most of them get it in the community rather than in hospitals. The Irish College of GPs is urging all their colleagues to be alert to sepsis and to refer patients to hospital quickly. We'll speak to its medical director in a moment, but first, Sean Hughes was just 15 years old when he died of sepsis in 2018. Afterwards, his parents set up the Lil Red Foundation to raise awareness about the condition. Sean's father, Joe, told our reporter Ethna Dodd about his son.
Sean was an up-and-coming rap artist. He's from Finglas and he's only 15 years and a half when he passed away. He was going to go on to do great things. On Monday, January the 8th, he came out from school and he told his mum, Karen, he wasn't feeling too well. He was displaying flu-like symptoms which were similar to those of the chest infection. And on the Wednesday, his mum, Karen, took him to the family doctor who examined Sean. The doctor said that Sean had a high fever and a bad chest infection. On Thursday evening, Sean was sitting on the sofa in the living room watching TV with his mum, Karen. Suddenly he became unresponsive. I was upstairs and Karen called for me. I came down the stairs and immediately got Sean off the couch, placed him on the floor, checked his airways, and I began CPR. And I continued to do CPR until the paramedics arrived and they took over. They took him into Temple Street Hospital. And Sean had no underlying health issues. The doctors were even baffled. They had no idea what was wrong with Sean. After a while, we were told by doctors that they wanted to do an MRI and move him into the intensive care unit. They let us know that we might want to have some family and friends around us, because all the indications were that Sean was not going to pull through and it might be only a matter of hours till he passed away. Our son Sean passed away in the morning hours of Friday, January the 12th, 2018. Life hasn't been the same for us since.
Joe, when did you know it was sepsis? That's what Sean died of.
We found out from the Temple Street Hospital, and the family GP told us that it was sepsis. So we've never heard of sepsis before that day. Myself and Karen now, we live by the words, what if? What if we'd have known more about sepsis? What if medical professionals dealing with Sean, if they'd have known about sepsis? Things might be so different, you know.
That's Joe Hughes there talking about his son Sean, who died aged 15 from sepsis. We can talk now to Dr. Diarmuid Quinlan, who is the medical director of the Irish College of GPs and a practising GP in Clonlara in County Cork. Dr. Quinlan, you're very welcome indeed. Devastating there listening to Joe talking about Sean dying so young at 15. What is sepsis?
I suppose my heart goes out to Joe and his family and the tragic loss of their son. And I suppose I'd like to start by remembering all those people today and their families who've been tragically affected by sepsis. They are very much foremost in our mind. Sepsis is a leading cause of death in Ireland. We have over 15,000 cases a year and almost 20% die. So that's over 3,000 deaths from sepsis a year. And when we think that there's 30,000 people die in Ireland every year, for 3,000 to die of sepsis puts the enormity of sepsis in perspective. The symptoms of sepsis are, first I suppose, it affects people at the extremes of age. So it's children and small babies particularly, and then older people, particularly people over the age of 75, are much more likely to get sepsis.
What is it, Dr. Quinlan?
Sepsis it's a life-threatening abnormal immune response to an infection, and the infections most commonly are in the lungs, urinary infections in the skin and in the tummy. And I suppose it's really important for people to know and recognise the symptoms and signs of sepsis and then go and see a doctor urgently. And the symptoms and signs really are very common, and they're often very non-specific and vague. And they're similar across children and adults. They can be a little bit different, but with children, particularly a high-pitched cry or irritable, often very agitated, confused, sluggish, hard to wake. So there's some of the symptoms: cold hands, cold feet, decreased feeding with children, dry nappies, pale, blotchy, cold skin, cold lips, the non-blanching rash that we know of. And then sometimes people can have severe muscle pain, particularly in the legs, difficulty walking. They can breathe very fast or difficulty breathing. People can have a high fever or can have chills and shivering, headache and vomiting. So the symptoms are very broad and often non-specific. The people who tend to get it really are, as I said, the children and the people at the extremes of age. And then people with chronic conditions like, for example, diabetes, liver disease, heart disease. And then people on certain medications, particularly steroids and immune suppressants, or people who've had recent surgery are more likely to get sepsis.
Okay.
And then
So
In terms of
just to clarify, some people might think that sepsis is something, it's a response that your body gives to something else that is infecting your body.
yes,
Is that true?
yes, it's a life-threatening abnormal immune response to an infection.
Okay, so you have an infection to begin with,
Yes,
and then the sepsis
absolutely.
is the response to that.
And commonly the infections are in the lungs, the kidney, the urinary system, the skin, or the tummy. That's where the infections are. Um, I suppose in terms of prevention, like prevention is really important with sepsis, and the WHO, the HSE, and the Irish College of GPs all would encourage, and vaccination is so important. And GPs last year gave over 750,000 flu vaccines, 500,000 COVID-19 vaccines, pneumonia vaccines. I would encourage people to get their flu and COVID vaccines. People over 60, children aged 2 to 17. We now have the needle-free nasal spray vaccine. Pregnant women, people with chronic diseases, people living in residential care facilities, nurses, nursing homes, and those who care for them or live with people with chronic diseases. So, if you're looking after somebody who's older, who's a chronic disease, consider getting the flu vaccine, the COVID vaccine to protect your loved ones.
Okay, listening there to Joe talking about his son, it didn't appear that sepsis was on the radar of the medics, at least initially. Should medics, GPs be more alert to sepsis?
I suppose the sepsis really came very much onto our radar nationally with the very tragic and untimely death of Savita Halappanavar over a decade ago. And the HSE have, to their credit, put an enormous amount of resource into addressing sepsis in hospitals. And in the last year or more, the HSE have now supported general practice to develop education resources for GPs. And we are launching these resources today in Dublin to support GPs to increase our ability to recognise patients with early sepsis. And that does bring a challenge for GPs because every day across the country, GPs see over 75,000 people. Our GP nurses give huge number of vaccinations. We see people very early in the disease trajectory. So often we see people very early when they have their infection, when it may not be sepsis at that stage. We have an increasing ageing population. So we went from over 700,000 people to over 800,000 people over the age of 65, which is fabulous. But it does mean there are substantially more people who are at risk of developing sepsis. So there are unique challenges and unique opportunities for GPs in the early detection of sepsis.
We'll leave it there for now. Thank you very much, Dr. Diarmuid Quinlan, Medical Director of the Irish College of General Practitioners.